Did you know that bowel cancer, also known as colorectal cancer, is the third most common form of cancer worldwide? Each year, more than 1 million new cases are reported globally. Bowel cancer doesn't discriminate, striking in every corner of the globe, from the bustling cities of America to the quiet rural villages of Africa. It's a silent invader, often showing no symptoms until it's well established and harder to treat. That's why early detection is so crucial. It can literally save lives. Understanding this disease, recognizing the risk factors and symptoms, and knowing the importance of regular screenings can make a world of difference. And that's what we're here for. This illness may be widespread and formidable, but it's not unbeatable. We have the tools, the knowledge, and the will to fight it. It's a daunting fact, but knowledge is our best defense. Let's arm ourselves with it. Understanding bowel cancer starts with knowing what it is. Let's unmask this often misunderstood disease. Bowel cancer, also known as colorectal cancer, is a type of malignancy that can form in the large intestine or the rectum. It starts as small, non-cancerous clumps of cells known as polyps. These polyps are like tiny mushrooms growing on the inner walls of the bowel. Over time, some of these polyps can change and grow into cancerous tumors. This doesn't happen overnight. It's a slow process that can take years, even decades to develop. Not all polyps become cancerous, though. It's like a game of roulette, where the odds are, thankfully, in our favor. Most polyps remain harmless throughout a person's life. However, the ones that do transform hold the potential to cause significant harm. They become the seeds from which bowel cancer grows. While not all polyps become cancerous, the ones that do lead to bowel cancer. Bowel cancer is not just a single disease, it wears many masks. In the world of colorectal cancer, there are several types, each with its unique characteristics. Let's start with adenocarcinomas. This form of bowel cancer, which begins in cells that make and release mucus and other fluids, is the most common, accounting for about 95% of all cases. Then, we have carcinoid tumors. These start in specialized cells in the intestine, and while less common, they still play a role in the overall picture of bowel cancer. Finally, there are gastrointestinal stromal tumors, or GISTs for short. They are rare, but they do occur and can be quite aggressive. Each of these types of bowel cancer presents its own challenges in detection and treatment. However, understanding the many faces of this disease is a crucial step in the fight against it. Remember, adenocarcinomas account for the majority of bowel cancer cases. While the exact cause of bowel cancer remains unknown, certain factors increase its risk. Let's talk about some of these invisible triggers. Age is one such factor. The risk of developing bowel cancer rises notably as we age, with most cases occurring in people aged over 50. However, it's important to note that it can affect anyone at any age. Our diet also plays a significant role. A diet low in fiber and high in processed and red meats can increase the risk. Consuming a diet rich in fruits, vegetables, and whole grains, on the other hand, can help protect against bowel cancer. Next up is obesity. Obesity doesn't just affect your heart and joints, it can also increase the risk of bowel cancer. Regular physical activity and maintaining a healthy weight are key in reducing this risk. Smoking and alcohol consumption are also high on the list of risk factors. Both of these habits can lead to a multitude of health issues, including an increased risk of bowel cancer. Cutting back on alcohol and quitting smoking are effective ways to lower this risk. Lastly, we cannot overlook genetic factors. Certain inherited genes, gene mutations, and conditions like Lynch syndrome can increase bowel cancer risk. It's crucial to be aware of your family's medical history and discuss any concerns with your healthcare provider. So, while these risk factors may seem daunting, it's important to remember that many of them are within our control. By adopting a healthy diet, maintaining a healthy weight, staying physically active, and avoiding harmful habits like smoking and excessive alcohol consumption, we can significantly reduce our risk of bowel cancer. Regular checkups and screenings are also vital, especially if you have a family history of the disease. In the face of these invisible triggers, awareness and a proactive approach to our health can make a world of difference. The risk factors may be many, but a healthy lifestyle can keep most at bay. Many people with colon cancer don't have symptoms at first. When symptoms appear, they'll likely depend on the cancer's size and where it is in the large intestine. The common symptoms often masquerade as less serious health issues, making them easy to overlook. For instance, Changes in bowel habits, such as constipation or diarrhea, can be an indicator of bowel cancer. Rectal bleeding, too, is a symptom, though it's often dismissed as a result of hemorrhoids. Abdominal discomfort, whether it's cramps, gas, or pain, can also be a sign. It's the kind of discomfort that persists for days, refusing to be brushed off as a mere stomach upset. Then there's fatigue, not the kind that follows a long day, but the kind that drains you without reason. Unexplained weight loss, despite maintaining your usual eating habits, can also be a warning sign. Early detection is key, so always listen to what your body is telling you. When it comes to diagnosing bowel cancer, medical professionals have a range of tools at their disposal. In the critical pursuit of detecting bowel cancer, a variety of diagnostic methods are employed. One of the first steps in this process is a simple physical exam, where a healthcare provider checks for any physical signs of bowel cancer, such as abdominal bloating or a noticeable change in body weight. Blood tests are another common diagnostic tool. These can reveal the presence of certain substances that may indicate the existence of cancer. However, blood tests alone cannot confirm a diagnosis of bowel cancer, but they provide valuable clues that guide further investigation. Next in line is the colonoscopy. This procedure involves inserting a long, flexible tube with a tiny camera attached into the rectum to examine the entire colon. If any suspicious areas are found, the doctor can remove a small piece of tissue for examination under a microscope, a process known as biopsy. This is the definitive way to diagnose bowel cancer. Imaging tests such as CT scans or MRI scans are also used to get a detailed view of the patient's internal organs. These tests can help determine the size and location of the cancer and whether it has spread to other parts of the body. Most bowel cancers start as benign, non-threatening growths known as polyps. These can take several years to develop into cancer, and not all polyps become cancerous. This is why regular screenings are so crucial. They can detect these polyps before they have the chance to become malignant, drastically reducing the risk of developing bowel cancer. So if you're over 50 or have a family history of bowel cancer, regular screenings should be a part of your healthcare routine. Even if you're younger and don't have any risk factors, it's essential to be aware of the symptoms and consult a healthcare provider if you notice anything unusual. Early detection is possible with regular screenings and vigilance. Remember, your health is in your hands, and the best defense against bowel cancer is early detection. Bowel cancer may be a formidable foe, but it's not undefeatable. In the battle against this disease, we have a variety of weapons at our disposal. One of the primary treatment methods is surgery. This involves removing the tumor and some surrounding healthy tissue to ensure no cancer cells are left behind. In some cases, it may be necessary to remove larger sections of the bowel, but modern medical advancements have made these procedures safer and more successful than ever before. Radiation therapy is another treatment method often used, particularly in conjunction with surgery. This treatment uses high-energy rays to destroy cancer cells. It's often used before surgery to shrink a tumor, making it easier to remove, or after surgery to kill any remaining cancer cells. Chemotherapy, which involves using drugs to kill cancer cells, is another commonly utilized treatment. It can be used before surgery to shrink tumors, after surgery to kill any lingering cells, or as the main treatment for advanced bowel cancer. Targeted therapies and immunotherapies are newer treatments that work by targeting specific characteristics of cancer cells or boosting the body's immune system to fight the cancer. These treatments are often used in combination with traditional therapies to increase their effectiveness. Now let's talk about survival rates. It's important to remember that survival rates are averages and can't predict individual outcomes. However, they do give us a broad picture of the landscape. For early-stage bowel cancer, the 5-year survival rate is over 90%. This means that more than 9 out of 10 people with early-stage bowel cancer are still alive 5 years after diagnosis. For cancers that have spread to nearby tissues or lymph nodes, the survival rate drops to about 70%. And for those that have spread to distant parts of the body, the rate is around 14%. However, these numbers are constantly improving due to advancements in treatment and earlier detection methods. While much attention is rightly given to the individual battling bowel cancer, it's essential not to overlook the significant impact on their loved ones. Family members often experience a range of emotions, from fear and worry to stress and uncertainty. Providing support for these caregivers and family members is paramount. This support can come in various forms, including offering a listening ear, providing practical assistance with daily tasks, encouraging self-care, and connecting them with support groups or counseling services. By recognizing and addressing the needs of the entire family unit, we can create a more nurturing and resilient support network for everyone affected by bowel cancer. The battle against bowel cancer is tough, but with early detection and proper treatment, it's a battle we can win. With a healthy lifestyle, regular screenings, and swift action when symptoms appear, we can turn the tide in this fight. Before we wrap up, I want to encourage you to share your thoughts on bowel cancer in the comments below. Also, don't forget to check out our other health-related videos for more valuable information. Together, we can raise awareness and support each other on our health journeys. Thanks for watching, and until next time, stay healthy and informed. See you in the next video.